Myself Dr. Mrudula, Associate Professor, Department of Prasuti Tantra Streeroga, Yenepoya Ayurveda Medical College and Hospital. I am here in front of you to present on the topic Garbha Vijnana, a smaller topic under Garbha Vijnana. So today we are going to learn about fetal nourishment and fetal circulation and the concept of Garbha Poshana that is explained in Ayurveda. So coming to fetal nutrition, that is mode of fetal nutrition are mainly of three types, that is three stages. First one, that is absorption stage, second one histotrophic transfer, stage 2, and the stage 3, that is hematotrophic transfer. Coming to stage 1, that is post fertilization or just before implantation. So most of the nutrition that are supplied by absorption of nutrients stored in the cytoplasm of zygote and nutrition supplied from tubal and endometrial secretion. So, following the nidation of blastocyst and before the establishment of uteroplacental circulation, so exchange of gases, foodstuffs and waste products occurs by diffusion from the trophoblast lacuna. This is stage 2. So, after the establishment of uteroplacental circulation up to delivery, that is from 3rd week onwards, fetus delivers its nutrition by active and passive transfer through the placenta and amniotic fluid. This is stage 3. So coming to fetal circulation, once the establishment of uteroplacental circulation, so there are two umbilical veins, mainly right and left. So blood from the placenta, that is 80% saturated with oxygen, reaches the fetus by way of left umbilical vein. So on reaching the liver, most of the blood flows through the ductus venosus directly into the inferior vena cava. Smaller amount of blood enters to the liver through left portal vein and mixes with the portal venous blood. So at inferior vena cava, the blood also mixes with the blood returning from the lower limb and enters the right atrium. You can see in the image. So from the right atrium, most of the blood passes directly into the left atrium through foramina ovale. So some amount of blood which is remain in the right atrium that mixes with the blood returning from the head, neck and upper limbs by way of superior vena cava. So from the left atrium, where it mixes with a small amount of blood returning from the lungs and enters the left ventricle and flow it into the ascending aorta. So whatever the blood remaining in the right atrium that enters the right ventricle into the pulmonary trunk directly through ductus arteriosus into the arch of aorta, descending aorta and to the placenta by way of two umbilical arteries. So this is the basic fetal circulation. So the changes that happens, the changes in the fetal circulation at birth. So due to cessation of placental blood flow and initiation of respiration, there is closure of umbilical artery. So functional closure that occurs immediately after the birth, but actual obliteration takes around 2 to 3 months. So closure of umbilical veins, so umbilical vein that converts or it changes into ligamentum teres, ductus venosus, so it becomes ligamentum venosum. Closure of ductus arteriosus, so closes around 1 to 3 months after the birth and it becomes ligament arteriosum. So closure of foramina ovale, functional closure occurs soon after the birth and anatomical closure occurs in about 1 year. So coming to the Ayurvedic concept of Garbha Poshana or fetal nourishment or fetal circulation. So this is what told in Ayurveda. So we get plenty of references in Ayurveda regarding Garbha Poshana. Coming to the first references, that is from Charaka Samhita Sharirasthana. So Matradinam Khalu Garbhakaranam Bhavanam Sampadastata Vrittasya Saushtavat Matrataschaiva Upasneha Upasvedabhyam Kala Parinamat Swabhava Samsiddescha Kukshav Vriddhim Prapnati. So Acharya Charaka clearly says that the fetus obtains its nourishment from the rasa that is supplied from the mother. So through the process of upasneha as well as upasveda, and it is also influenced by the time factor along with its own desires. So this is what told by Acharya Charaka. So mainly fetus gets its nourishment through two processes, that is upasneha and upasveda. Also there are certain other factors, that is kala parinama, time factor, as well as swabhava. Swabhava here refers to its own desire, that is the desire of fetus. So here because of all upasneha and upasveda, kuksha vriddhim prapnoti. So fetus gets its nourishment and it grows inside the kukshi or mother's womb. So coming to the another reference, so according to Ashtanga Hridayakara, so we get the reference Garbhasya nabhau matuscha hridi nadi nibhadyate yayasa pushti mapnoti kedara iva kulyaya. So Acharya Vagbhata says that From the umbilical cord, the rasa reaches the fetus and nourishment occurs by Kedara Kulyanyaya. So, Garbhasya Nabhi or fetal Garbhasya Nabhi connected to Matuscha Hridi Nadi. So, he clearly says that fetus is connected to the mother or Hridi Nadi. So, it grows by the nourishment which is obtained from the mother. And he just gives a simile, that is Kedara Iva Kulya Nyaya. So, it grows in the mother's womb or it is connected to mother. So, coming to another reference from Kashyapa Samhita Sutrasthana, here Acharya opines that Yadanna Panam Prayena Garbhini Stri Nishevate Raso Nirvartate Thadrik Trida Chasya Pravartate. Matu Pushtyartam Ekamsho, Dvitiyo Garbha Pushtaye, Tritiyaha Stana Pushtyartam, Narya Garbhastu Pushyati. So, food taken, whatever the food taken consumed by the pregnant woman, it divides into 3 parts. So, Yadanna Panam Prayena Garbhini Stri Nishevate, whatever food that is taken by the Garbhini Stri or the pregnant woman, Raso Nirvartate Tadak Trida Chasya Pravate. So, it divides into 3 parts. Matuhu Pushtyartam Ekamsho, Matuhu Pushti. So, one part nourishes the mother or the pregnant woman, Garbha Pushti. The another part that nourishes the fetus, Stana Pushti. One part helps in the nourishment of breast or the preparation of lactation. So, mainly the food whatever taken by the Garbhini Stri, that is divided into 3 parts. One part that helps in the nourishment of pregnant woman, another part that helps in the nourishment of fetus, and the third part that prepares the breast for the lactation. So, to conclude, a proper understanding of fetal circulation and fetal nutrition will help us to understand the basic concept behind fetal nourishment during pregnancy, and we get plenty of references in Ayurveda regarding fetal nutrition during pregnancy under the concept of Garbha Poshana. So, these are the list of references. Thank you.